So I'm deeply humbled and so grateful to be recognized as an exceptional woman in medicine for Castle Connolly Top Doctor, because your peers are who vote for you, and so it just means a lot that they have faith in me and that they trust me with their patients. I always wanted to be a doctor from the time I was probably 5 years old, and I decided to go into dermatology because when I was 18, I got the chicken pox and was left with scars on my face, and I was introduced to a dermatologist, and they were able to help restore my self-esteem and my confidence, and so I saw firsthand what a dermatologist can do for their patients. And so I really love the fact that patients can actually see what you're doing for them and that we can really help rebuild their confidence. So as a female physician, I think my personal experience and my background makes me a compassionate physician and an empathetic listener, and so I hope to provide a more inclusive approach to my patients. So I think the field of dermatology is constantly advancing, and there's always more research that could be done specifically in women's health. I know there's a lot of conditions that we still struggle with, especially hormone-specific conditions like melasma or even adult acne. And so with time, I think we can improve our approach with further research in these areas. So AI is such an exciting field, and I'm starting to see it in medicine. And I think that in dermatology specifically, what I've seen is a lot of new apps that are taking AI and using that to help diagnose skin conditions and help diagnose skin cancer, especially in areas where dermatologists are not always available, or difficult to access, or the wait time can be long. So I think this is a new tool that may help assist, not necessarily like replace a dermatologist, but may assist in letting patients know whether something is worrisome and whether they need to come in to see an expert. But I've also seen new robots that are being developed to inject patients. I'm not sure how my patients feel about having a robot inject their faces, but it's just interesting to see the new technology that's coming and how we can use it to improve technique, improve human error, and help with patient access. So trends that I see within cosmetic dermatology are a need, I guess, for non-invasive treatments. Patients want less downtime. They're not really looking for surgery as much as they used to. They're not interested in invasive procedures like facelift that cause scarring and have more health risks. And so there really is this push towards more non-invasive treatments, and so we're seeing that with procedures like ultrasound that stimulate collagen for tightening, or microcoring, which mechanically removes microcores of skin to help remove loose skin, which is an alternative to facelifts and things like that. So really the trend is less downtime, less invasive treatments with less risk, and patients are willing to trade less efficacy for a safer, easier treatment. So one concern that we have is the future of cosmetic dermatology, where it seems like it's a simple procedure, but really these are medical procedures that require a lot of training and expertise and a lot of understanding of anatomy. And so unfortunately, I see a lot of complications from places that are using providers that don't have enough training, that don't take patient safety very seriously. And so it's important for patients to understand the difference between someone who's gone through medical training and has hours and years of training versus someone who takes a weekend course, because cosmetic procedures are medical procedures and shouldn't be done at a Botox party or at a place where they don't understand the ramifications of these procedures.